Hello everyone, and welcome to today's webinar. During this 1-hour webinar, we will provide an introduction and overview of the key elements of the new INEE half-day training module on psychosocial support and social-emotional learning. Before we get started, please mute your microphones and turn off your video cameras so to minimize background noise. Please post any questions you have throughout the presentation in the chat function. We will aim to answer your questions at the end of the webinar, where we have reserved time for additional questions as well. Please note that this session is being recorded and it will be shared on INEE's website. The PowerPoint presentation, which you see on your screen, will also be posted on the website. My name is Margie Bott. I am the Education Policy Coordinator at INEE, and I'd like to introduce my fellow presenters to you. Joining me is my fellow colleague, Lauren Gherkin, who is INEE's Gender and Education in Emergencies Consultant. We also have Andrea Diaz-Varela, who is the Education Specialist at Right to Play, and Julia Finder-Jonah, who is the Education and Emergencies Advisor at Save the Children. During the webinar, we will first introduce INEE and the INEE Psychosocial Support and Social Emotional Collaborative. Then share the background documents from which the training module was developed and rationale for developing it. We will provide an overview of the module development process and then an overview of the content of the module itself. You will have a chance to engage with the training content itself later on in the webinar. We will then share some recommendations for using the module, and we would like to hear from you about how you might use it in your work. Finally, we will allow some time for questions and answers at the end. So let's get started. So as many of you may know, INEE, or its longer name, the Interagency Network for Education in Emergencies, is a network that's made up of 15,000 individual members working in the education and emergency sector. Our members are humanitarian practitioners, policymakers, donors, UN agency workers, academics, and others. If you're not a member already, I encourage you to visit inee.org and become one. Among many things INEE does, we have working groups that convene for a 3-year period, focusing on timely thematic areas of work within the education and emergency sector. Psychosocial support and social emotional learning, or PSS and SEL, as I'll be and other presenters will be saying throughout, have been a priority working area for INEE working group members since 2014, when a subgroup formed on the topic from 2014 to 2017. The PSS-SEL Collaborative, as it's known now, formed in 2018 and is the continuation of the PSS-SEL subgroup. The collaborative builds on the momentum and achievements of the previous group with the same aim to better support ongoing work in PSS and SEL in crisis contexts. Members of the collaborative work across agencies to address gaps in policy, practice, and research. The collaborative is made up of members from 18 different agencies, and you can find a list of these agencies on INEE's PSS-SEL Collaborative site page. You will see the link for this page pop up in your chat box. So please do check it out to see what the current working plan is for this group, in addition to the creation of this training module. The collaborative is currently co-convened by the IRC and Save the Children. Save the Children is represented by Julia, who is one of our presenters today. I would like to pass on the mic to Andrea Diaz-Varela, who is also a member of the collaborative, to tell us more about the foundational documents that shape the training module we are discussing today. Andrea?
Hi, everyone. Great to be here. So during the last INEE strategic period, the collaborative was very hard at work producing some global sector guidance on psychosocial support and social emotional learning, which represented a very important milestone for the EIE sector. So these that you see on the screen here were developed in response to a demand from INEE members for additional guidance on how to integrate psychosocial support and social emotional learning into EIE programming. So the background paper came first, which is on the right. And this background paper helped to clarify PSS and SEL terminologies and approaches related to PSS and SEL, and also explained how PSS and SEL actually relate to each other. Following this guidance note, following the background paper, the guidance note was developed. And this guidance note offers very specific strategies alongside each of the minimum standards about how to integrate PSS and SEL into education response. Great. So now in this current strategic period, the collaborative developed a training package to respond to feedback on the guidance note and background paper. The feedback was that though those two documents are very rich in technical content, there still was a lack of awareness about those documents at the field level. And the content was not user-friendly enough for the staff implementing programs on the ground, and more operational guidance was needed. So the training module that we're talking about today was developed as a way to disseminate the same messages in the guidance note and the background paper, and offer a way to make those two resources more useful and practical at the field level. So the guidance note and background paper have principles and suggested practices for psychosocial support in SEL, and the training module supports participants to apply those same principles and practices to their own experience and contexts. We are also exploring this as a way to capture more information about what additional support might be needed on PSS and SEL from the field by tracking the use of this training module. It was not easy to track the use of the guidance note and the background paper, so this is one way. And finally, the training module also complements the INEE EIE harmonized training package, and can also serve as a standalone module to support capacity building efforts in this area of work.
Thanks, Andrea. I would like to share a little bit more about the development process of this training module. The initial draft of the module was financially supported by Finchurch Aid, and the first draft was developed by a consultant named Dr. Johanna Kirki, who is the special education lecturer at the University of Eastern Finland. The INEE PSS-SEL Collaborative members provided 3 rounds of feedback on the drafts of this module, and adjustments were made by Dr. Kirki from March to May of 2019. An in-person consultation was held during INEE's working group meetings in Helsinki, Finland during May 2019, when an updated version of the module was presented by Dr. Kirki, and additional feedback was given by collaborative members. 4 pilots were conducted over the span of 3 months by 6 agencies. Some pilots were led by 2 agencies coming together. Pilots took place in Indonesia, the US, and Canada, with headquarters and field level program staff, working group coordinators, and Ministry of Education representatives. Considerable feedback was received from the pilots, with specific notes on needs for further development of the module. Through the feedback process, we learned that the concepts in the earlier draft of the module were overly scientific, and it was difficult to facilitate learning in a short time frame with dense material. There was also feedback that more active engagement of participants through interactive and thoughtful activities were needed, and varied pedagogical opportunities were requested by facilitators. As well, contextualization guidance was requested from the earlier piloting phase. The final module considers feedback provided across the various iterations of the module process, and especially from the in-person consultation and notes provided by facilitators during the pilot phase. The overly technical aspects of psychosocial well-being were simplified and made more relevant to the individual experience. A human-centered focus was applied across the training sessions. More activities and diverse pedagogical approaches to learning were added, with optional activities for those who could dedicate more time to the training were also included. Contextualization guidance was also included, of which you will learn a little bit more about shortly. As well, a complete redesign was done to make the content more clear and easier for facilitators to navigate. The final version was put together and supported by the INEE Secretariat. The process was led by Lauren Gherkin, who is one of our presenters today, who provided extensive updates on the organization, design, pedagogy, and the pedagogy of the content. The content was approved by the collaborative members in early November. I'd like to now invite Lauren to share more with us about the content of the training materials, to provide a brief overview of the objectives of the training and take us right into the actual activities of the training. Lauren?
Thanks, Margie. So as you mentioned, I'm going to talk a little bit more about the structure and the content of the module, starting with these training objectives. So as Andrea mentioned earlier, this module was developed as a way of disseminating the background paper and the guidance note, but also as a way of making the content more accessible to people who may not have a background in PSS and SEL. So this is an introductory training, and the objectives are twofold. So first, to ensure that the participants are familiar with key terms like well-being, stress, psychosocial support, social and emotional learning, and resilience, essentially that they're able to define those terms in their own words and identify examples of them. But secondly, we want participants to be able to go a step further, to be able to identify PSS and SEL interventions, explain how they are successful or not, how they're relevant or appropriate or not, and be able to use tools like the guidance note and the background papers to suggest improvements to those interventions, or to be able to develop their own. So now let's delve into the structure and the content of the module a little bit. As Margie mentioned before, this training is designed to be modular. There are 3 hours of core activities making up a half-day training, and an additional 2 hours of supplementary activities, which allow participants to discuss or practice concepts in more depth. These supplementary activities can be used to extend the training to a full day. They can be added to other trainings, or they can be used for continuing professional development. So as you can see, the module is divided into 2 sections. Part A, defining key concepts, and Part B, strategies for promoting psychosocial well-being through education. The first section, as the name describes, is really focused on ensuring that participants understand those key concepts in PSS and SEL. The sessions are structured so participants can build off of their existing knowledge and personal experience of concepts like well-being and stress in order to understand potentially new concepts like PSS and SEL. The second section is much more focused on applying those concepts and looking at PSS and SEL interventions. This section is oriented around case studies, which participants use to identify interventions, analyze those interventions, and then suggest improvements. Participants also have the option to develop an action plan for their own PSS and SEL intervention. We tried to make the training as practical and interactive as possible using a range of different activity types. So brainstorming, discussions, mingling activities, matching activities, opportunities to get participants up and moving around and interacting with each other, so that they really had the opportunity to engage with the material and deepen their understandings of those concepts. This training was initially designed to be used in a face-to-face setting, but as you'll see later, it can be adapted for virtual trainings. For example, small group work can be done in a breakout room, or board work and flip charts can be replaced with Jamboards or Google Docs. So we're going to dive into some of the actual materials. As you can see, the training materials are made up of a slide deck and a facilitator's guide. And we're going to take a little bit of a closer look at that facilitator's guide. All right. So let's look at a few key sections. This document starts off with an introduction to the training, including an overview of what you can expect in the training, some key messages and learning points, and then an overview of the training materials. So as you can see, there are links to the slide deck, internal links to facilitator materials and participant handbooks, to PDF and Word versions, links to the guidance note on psychosocial support, either the digital copies or the link to request hard copies. And we'd like to draw attention to this facilitator feedback form in particular. So this resource really helps us understand how and where the module is being used and helps us identify aspects that we may need to update. There's also a participant feedback form to make sure that, that we're getting multiple perspectives on the training module and what works and what doesn't. Moving down to this session outline that we just went over before, but this is in a little bit more detail. So it's broken down by slides and activities related to those slides. And as you can see, these supplementary activities are in a different color to help the facilitator differentiate between them and help them decide which activities they would like to incorporate and which they think that they can do without. All right. We also have more information on the resources that are provided, so participant handbooks and facilitators materials, some more information about how to prepare to use those materials and any materials that the facilitator may need to obtain on their own. And then moving into this contextualization and adaptation guidance, which Margie mentioned beforehand. So like other INEE tools and resources, we really expect facilitators to review the content in advance and ensure that they're considering the audience and the context where they plan to facilitate the training. Throughout this training, you'll see a little pencil icon, which I'll show you in a minute, where we've marked instances where this module could particularly benefit from contextualization. The way that the module is contextualized is largely up to the facilitator, but we've provided some guidance in this section on how to support that process and essentially providing a place to start. Additionally, if you are interested in contextualizing this resource, it would be really helpful if you could share back any context-specific resources that you develop that we can then pass on to others who are going to use the training in a similar context. So moving into the facilitation guide, which is really the meat of this material. Here's that contextualization icon I mentioned earlier. So the facilitation guide is organized by slides. And next to each slide, there's a description of the activity that's attached to that slide. So it includes the duration of the activity, materials needed. So if those are handouts, if those are flip charts or facilitator materials, and overview of how to facilitate the activity and any key learning points, and then a suggested script with questions in red and example answers in blue. You'll also notice that some of these slide sections are in gray. This is to indicate that this is a supplementary activity. Supplementary activities have all the same information that a core activity would have, but with an additional added section of this purpose. This is here to help the facilitator determine whether this activity would be useful or relevant to the way that they're doing the training to their participants. Slides associated with supplemental activities also have a gray background to help the facilitator differentiate between the two. So next, we're going to move down very quickly to these facilitator materials section. So here is the table of contents for that. Facilitator materials include resources, photos, game pieces, and discussion guides that help the facilitator guide participants through these through the activities. I'll give you a quick second to be able to look over that. You'll notice too that we have that little contextualization icon, not only in the script and the slide deck, but also in these resources for facilitators and participants. So some game pieces, answer keys, more photos, and here's that facilitator feedback form I mentioned earlier. The last part of these materials are the participant handbook. So these handouts are resources that participants can use during the training, like this key terms section, or this brainstorming activity, which we'll come back to later, or they're resources like this answer key that they can take home with them and refer to later when they're trying to remember some of the key concepts that we went over during the training. So that's a brief overview of these facilitator resources. Lots of fun visuals. So now we're going to talk a little bit more about the actual content. So since you've already spent quite a bit of time listening to us talk about the module, we thought we would give you an opportunity to actually participate in it. So Tess, if you could share the link to the Jamboard now, that would be really great. So we're going to do a really condensed demo of an activity from part A, coming back to this little diagram that you saw earlier. This activity is where this activity starts off part A with a discussion of what well-being means to people. So we'll come to that Jamboard. All right, I see a couple of people in here, but I'll give you a minute. 9 people, awesome. Great. So this activity is really geared at understanding what is well-being. So what do we need to feel well, to feel happy, to feel content or comfortable? There are a lot of different aspects that help us feel that way. So we're going to give you 2 minutes, and I'm timing, to think of some items, to think of some feelings, beliefs, or abilities that we all need to feel well. So draw on your personal and professional experiences to think of examples. And to do that, you're going to create a little sticky note. And you're going to, oh, interesting. And you're going to move that section over here, all right? So you have 2 minutes starting now. Don't worry if you see that other people have written the same idea. Your 2 minutes starts now. Ready? Go. I feel like we should have some Jeopardy music or something during this moment. Seeing lots of great answers here, so you have 1 minute left. 30 seconds. All right, time is up. Wow, I'm really impressed by how many awesome ideas you've put down in 2 minutes. Really great job, everybody. So as you guys can see by some of the examples that you've generated, there are a lot of different aspects of well-being. There are physical, social, and emotional aspects to well-being. So in order to feel well, you must have your physical and biological needs met, like food, water, shelter, and medical services. But you also have to have your social and emotional needs met, like feeling safe, having positive relationships with your family and community, and being able to practice your religious and cultural traditions. So why might it be important to understand what makes a person feel well? Well, in order to be able to plan and provide effective support, we need to understand what makes people feel well and what are the factors that really influence well-being. So looking at some of the answers that you've generated on this Jamboard, let's now think about psychosocial well-being in humanitarian contexts. So which of these aspects of well-being might be disrupted during humanitarian contexts, either during an environmental or a human-made crisis? So look at all of these wonderful Post-it notes that you've created. And if you think that that aspect of well-being might be threatened in a humanitarian setting, move it to the center of the board. So cover up our little student here. And you'll have another 2 minutes to do that as well. "30 seconds. Great job, everybody. All right, so thanks to everybody who participated. You drew from your personal and your professional experience to be able to generate this visual representation of well-being and the different factors affecting it. And then you thought about how how living in a humanitarian context might affect those aspects that that make someone feel well, that make someone feel happy and content. So usually we would use this activity then to segue from well-being into stress. So types of stress, levels of stress. So a slightly new concept for some people possibly. So I hope you enjoyed this activity. Now I'm going to hand it over to Julia, who's going to tell you about some different ways that we can use this training. Julia, you're still muted.
Sorry about that. Thanks, Lauren.
No worries.
So I'm sure that as you've been listening to this, you've already started thinking about, how might I be able to use this in the work that I'm doing on a daily basis? And so there's a few ways that we've come up with, but in a moment we'll have the chance to hear from you as well. But I thought we could start by sharing some of the ideas we've thought of. So one way that this training could work for you or for your organization would be anytime that you have a new staff member. So when new staff join your organization, if they don't have experience with this facet of education in emergencies, so supporting PSS or SEL programming, this could be a really great training to make as part of their orientation, just to familiarize them with the basic concepts of these two skills. So this could also serve as, if you have existing staff that might need a refresher on some of these concepts. Perhaps it's been a while since they've been exposed to the terms, different strategies you can use to operationalize these concepts. This could help them by giving a refresher. It could also serve as an introduction to the topics of PSS and SEL for staff in other sectors. As we try to have more cross-sectoral integration and designing of holistic programming, we think this could be a great course to give to protection colleagues, WASH colleagues, nutrition colleagues, anyone that you're working with on designing an integrated program. Another idea could be introducing this topic for your own staff well-being to create more supportive working environments. This training does talk about links to different mindfulness practices and techniques that we can use for stress management, as Lauren just alluded to. And so this could be a great way for staff to come together and think about how can we be creating a more nurturing and supportive work environment? How can we be helping each other to communicate more effectively? Another possible way this could be used would be as materials for training modules with teachers, community members, parents and caregivers, education cluster members, government officials if relevant. Since this does give such a nice overview of these core concepts, you can use it in a lot of different ways with several different audiences. We could also use this to share with our communications colleagues. So when colleagues are looking for information they can tweet about the great work that organizations are engaged in, this training material could provide them with some language they could use in their communications. This could also be used to help with contextualization. So when we're integrating PSS and SEL into our education programs, we know that it is really important to discuss this with colleagues to understand what do PSS interventions look like in this context? How are SEL skills actually expressed in this location? And using that to ensure that as we design our programs, we're doing it in a conflict-sensitive way. And our final idea that we came up with could be as a jumping off point for staff. So really getting staff to think about how do we want to address this issue in the communities where we work? We know that in some communities and in some contexts, talking about psychosocial support or even social emotional aspects can be rather taboo, or it's not something people are very comfortable talking about. So, this training could provide us with a way to kind of start that conversation. We can use this module to talk about what do we know already about this context? What don't we know? What do we need to know so that we can better incorporate this into our program design and bring staff up to speed as they're getting ready to support the implementation of programs or monitoring ongoing programming. So if we look at the next slide, now we'd actually really like to hear from you as well. So how do you think you might be able to use this module in your work? And again, we would really appreciate it if you could complete this Jamboard activity so we can have all of your answers and consider this as we're planning for the rollout of this training. So if you could all click on the link, and let's just take a couple of minutes to post some ideas. And I'm hoping that some of you will have some ideas to share with us. Great, thank you so much. Some great ideas are coming in. Let's give about 1 more minute to come up with some ideas. Yeah, so if we look here, seeing things like staff continuous professional development, possibly influencing some research designs, how we can train teachers for our own well-being, possibly for influencing assessments we develop. Yeah, a lot about that cross-sectoral collaboration, especially with protection. Excellent. Okay, thank you everyone for contributing to this. I think we can return now. And so we wanted to share with you what our plans are and what we're thinking about moving forward with this. So now that this module has been developed, we are in the process of making this available in all INEE languages. So Arabic, French, Spanish, and Portuguese, in addition to English. And this will be done by January 2020, which we're very excited about. Something else that we hope to use as a way to keep you all engaged, and something we encourage you to do, is to reach out to the PSS and SEL Collaborative of INEE if you're interested in possibly facilitating this training for your colleagues. We might be able to put you in touch with another organization that's planning on facilitating this training in the same location, and perhaps it could end up being a joint collaborative training done between your two organizations. Also, if you're interested in providing any feedback on the training for data-informed revision. So after you roll it out, any feedback you have based on that experience, we would really like to collect. And so far, we have had a couple of PSS and SEL collaborative members roll out this training, and they have given us feedback, and it's been extremely helpful. So we would like to continue with that moving forward. And this nicely links to the next bullet point, which is all about any time that you are investing in translating, contextualizing the materials, we would really like to develop a repository for this so that we don't all end up spending the same resources duplicating work. So if you are able to translate this into another language based on the projects you're supporting and the context you're working in, please share this with us so we can then share it with the wider INEE community. We also are really interested in tracking all of that adaptation and contextualization. So making sure that when you are making these changes, trying to develop some guidance material that could possibly be added in addition to the contextualization and adaptation guidance we already have, just based on experience that you have implementing this training. And then finally, there's a lot of work right now being done in the sector related to psychosocial support and social emotional learning, as you all are aware. And so there are several other ongoing initiatives where we see this training playing a role. And we're in the process of having several discussions to see how we can have this training be complementary to ongoing initiatives. So some of those initiatives are the development of an MHPSS minimum service package that WHO and UNICEF are leading. We know that NRC and University of Tromsø are also in the process of developing an EIE training on psychosocial support. And so seeing how some elements of this training can also be complementary to that. There's a lot of work happening with the Teachers in Crisis Conflict Collaborative at INEE, as well as the Education Equity Research Initiative around teacher well-being. So thinking about how aspects of this training related to teachers' own psychosocial needs and social emotional well-being can also be aligned with some of the work that those groups are doing. And then finally, with just thinking about, when we take this training to different countries, how some of this aligns with teacher competency frameworks that we have in countries and different ongoing initiatives at country level to support both teachers, parents, caregivers, and children in these contexts to have improved psychosocial support and social emotional well-being. And so with that, I will now take some questions. I think we can open it up for some questions. And if you could please ask your questions directly in the chat box, we would really appreciate it. I know that some questions have come in as we've been delivering this overview of the course, and that's great. So perhaps we can start with those. And then just as a reminder that any questions that are not answered during this webinar will be answered on a slide in this presentation and uploaded to the INEE website. So you should be able to find responses to those questions. So with that, maybe I'll turn it over to Lauren to take us through the questions.
I can do that, Julia.
Or Margie, thank you.
Yeah, thanks. So I see that several questions have come in, and thanks to Sarah and Tess who replied to some of those questions. Hopefully you're all able to follow that conversation in the chat function. A couple of questions that haven't yet been answered. I have, are there any information on the effectiveness of this training, perhaps data gathered during the 4 pilots? Thank you for that question. It's a great question. During the pilot phase, we really focused on how the materials were useful for the facilitators themselves and how the participants themselves found the training to be. So it was less about measuring the impact of the content itself and more about the training resource. But we hope, as Julia and Lauren have mentioned, that as people use this resource in its current state, that they provide us with more information about how they're using the resource through the facilitator feedback form and through the participant feedback form that we've provided in the package, so that we can plan for future training adaptations. We're really hoping to gather some data about how the resource is being used and monitored so that we can make it more effective and useful for those who need it. So thank you for that question. Another question, any plans to develop videos or whiteboard animations as additional facilitator resources? That's a great question, like the awesome CSE Pack videos. Yes, agreed that those CSE Pack videos were great, and it would be wonderful to be able to develop a whiteboard animation for this resource. We don't currently have the resources or the plans to be able to do so, but if you have ideas, you're more than welcome to please share those with us so we can think of ways to do that. Another question, how applicable is this for non-formal education programming? And fellow presenters, please do add if there's anything else that you'd like to share. So applicable for non-formal education programming, I think wherever psychosocial well-being is an aspect of programming, whether that's through formal education or non-formal settings, this training will be relevant. It's especially relevant for those who are facilitating psychosocial support and social emotional learning programming. So I would say it's very relevant. Presenters, do you have anything to add about the use of the training in non-formal settings?
I can just add that one of the case studies that the training module offers is on non-formal education as well. So there is a case about a child in Nepal during the earthquake in 2015 and a child-friendly space. So it looks in depth at how to apply the PSS and SEL strategies to that type of case. So I think, yes, there will be some good content there.
Thanks, Andrea. Next question is on any plans to develop, Though is meant to be self-explanatory, any idea of running a training of trainers at regional level? That's a great idea. That would be fantastic to be able to do. And we really encourage those of you who are online and other INEE members to come together for such a training. And please reach out to us at the PSS-SEL Collaborative. And so we can speak with all of the members to see if we can organize something. If there's a group of PSS-SEL Collaborative members who can convene this and facilitate and support with the training of trainers, that would be fantastic to be able to do. Thank you for the idea. Next question. Do you have a plan to organize the training? So we really encourage our members and those of you who are participating in this webinar to develop trainings in your context. And please do let us know if you are planning a training so we can put you in touch with any PSS-SEL Collaborative member who also has colleagues or partners in the area where you are conducting a training, so we can do joint trainings and support with facilitation as well. But at the moment, there's no training planned from the INEE side. Next question. When will you start this course? So this is not meant to be a course that we necessarily provide for those who want to conduct the training. This webinar was meant to introduce you to the resources so that you would be able to facilitate and create trainings yourselves. But of course, we're always available to provide ideas and resources wherever it may be possible to conduct a training. And potentially, if there are additional resources to conduct a training of trainers, we will be sure to send that messaging to all of our members. Let's see, another question. There are some form or basis to collect data. It would be great if we have some communication points to offer to after be able to read the data. Yes, that is a great question and idea. As I mentioned, it would be great to have all of the feedback that we can possibly get from those who are using this resource and facilitating the training, not only from the facilitators themselves on the content and usability of the training module, but also from the participants. As Lauren mentioned, there's a participant feedback form within the training pack. So it would be great if you do plan to use this training to make sure that those participants' feedback forms are filled out. And if you could share those with us, so we can gather the data and evidence needed to be able to put some of those data points together. And of course, we'd be happy to share that with you through the INEE website. And if you have additional ideas on how we can best monitor the impact of this training module, please do share that with us through the PSS-SEL Collaborative email address that was shared. Again, presenters, if there's anything I'm missing, please do jump in if you have anything to share. So many good questions coming in. Let's see. Is the content very specific to EIE context or general enough to use to train staff in SEL and PSS concepts in any humanitarian context? Julia, do you want to answer this question perhaps?
I think just as we mentioned in the training, right, that this would be a great training to give to a variety of different people working across various sectors. And so I don't think it is limited just to education or even limited just to humanitarian response. Especially when we think about the well-being of people, this is something that we need to think about for people everywhere. And so, yes, I think this has great relevance in almost any context. And, you know, when we think about social emotional learning specifically, actually a lot of this originated in Western, more stable development contexts, but we do see value in it across many locations.
Thanks, Julia. I completely agree. And I think it would actually be really interesting to be able to share it with those in other sectors not only outside of the education sector, but also outside of the humanitarian sector. Another question, are there contextualization tips to run this training totally offline, no PowerPoint and no electricity? Lauren, do you want to take this question?
Yeah, I can take that. That's a really good question. And yes, we've tried to make this training sort of as low tech as possible, so it can be run in an entirely virtual space, but it can also be run in a space with no PowerPoint and no electricity. PowerPoint is the only tech thing that we've included here, but in the contextualization guidance, there are notes on how to transfer some of the more important PowerPoint slides onto flip charts, for example. I think an only challenge would be ensuring that some of those facilitator materials and participant handouts were printed out beforehand, because some of those are quite vital to the training.
Thanks, Lauren. And maybe you could answer this next one for us as well. Does the approach also look at addressing the challenge of supporting accessibility of EIE for children with disabilities?
Yeah, I'm trying to think if we address that explicitly, and I'm not sure that we have. But I think that one way that you can more explicitly acknowledge the challenges and also sort of the benefits of supporting EIE for children with disabilities is through those case studies in Part B. I think Andrea mentioned earlier that we have a case study of a child in a non-formal education space. We also have a case study of a girl in an accelerated education space. I think it just depends on which case studies you choose to use, depending on sort of the main points that you want to focus on in the training. And one of the parts of the contextualization guidance that we've included is also ensuring that while we have provided these case studies for you, that it's really important that you use or you adapt case studies from your own context as well, to make sure that they're as relevant as possible to your participants.
Great, thanks, Lauren. Next question. This is not so much a question for this training as it is an idea for future presentations. Would the PSS-SEL group consider hosting a session on how to measure or demonstrate impact of psychosocial support interventions and trainings? Julia, maybe you could talk about some of the initiatives we have currently in the PSS-SEL Collaborative that have to do with measuring. If you could, thanks.
Sure. So some of you may have participated in a different INEE webinar, I believe on the 20th of November, which was the launch of the MENAT PSS-SEL Measurement Library. And so this library, which can be found on INEE's website, has several tested, valid, and reliable PSS and SEL measures that can be used in education programs where you're supporting the development of SEL skills and providing psychosocial support interventions. And so the PSS-SEL Collaborative has been working very closely with this research consortium that's been led by NYU's Global Ties and the IRC to develop this library of tools. So I encourage everyone to go onto INEE's website and look at the tools. Not only will you find tools, but you will find guidance on how to actually use these tools in programs, how to adapt and contextualize, training of enumerators if it's required, etc. There's also, I believe, contact information there should you have any follow-up questions about some of the tools.
Yeah, excellent. Thanks, Julia. And if you have measures to share, if there are tools and assessment resources that you're using in your context to measure PSS and SEL, please do share with us, so then we can share with others who may be in your context through the INEE measurement library. Next question is, have you liaised with the global IS cluster folks and UNHCR to ensure it is widely promoted at the country level. Julia, I'll come back to you once again for that. Thank you.
Okay, so the INEE PSS-SEL Collaborative is having several discussions with people that are part of, as I mentioned, working on the MHPSS minimum service package creation. We also coordinate a lot with the MHPSS Collaborative that is hosted by Save Denmark, lots of other working groups that exist in the sector that are supporting the development of global tools and resources for psychosocial support, social emotional learning, and comprehensive mental health and psychosocial support programming. So we are in touch. I know INEE also, I believe, is in touch with the standing committee or the steering committee for the IASC. And so yes, those conversations are ongoing. I think now that this has all recently been finalized, and so those are definitely conversations we need to continue having, especially with UNHCR, for example. And so thank you for bringing that up. Yeah, I think that's a good point. But rest assured, those conversations are happening to ensure that we are being coordinated as possible.
Yeah, and just to add, at the cluster level, there are individual cluster coordinators who have reached out to us through the Global Education Cluster Help Desk for this resource. And I believe there are trainings being planned as soon as some of the translations are ready. So, great. With that, I think those are all of the questions we have for today. Do we have any more questions, Sarah? Just the last ones. We have time for maybe one more question.
We have two more questions, Margie.
Okay.
And the doc.
Okay, we can make time for that. Let's see.
So I see the question about, I know these materials are meant to train teachers, but can they be adapted for kids in clinical group sessions? The materials are actually not designed to train teachers specifically. We could use it to train teachers, but really it's designed for training, a lot of education staff that are working on projects, or also teachers, parents, caregivers that are engaged in our education programs. But it's not just for teachers. I think if you're looking for a training just for teachers that does address some of these aspects, I might encourage you to look at the TIC package for teachers, because it does have an entire module on well-being, and it does talk about psychosocial support and some social emotional learning. So could it be used in clinical group sessions? Possibly. Margie, Andrea, I don't know if you have other thoughts on that.
I have some thoughts. I think that the training as a whole might be a little bit challenging for small children, but some of the activities in it, especially the more interactive, like matching activities on symptoms of stress, or maybe a simplified version of the activity that we just did as a group, I think some of those could definitely be adapted for children. Just sort of more focused on mindfulness activities, for example.
Yeah, and I would agree, Julia, that I think the Teachers in Crisis Context Pack, there's a whole well-being chapter in there that would be a little bit more effective to use for teacher training. And while this module is very modular in its nature, and you can pick and choose from the sessions, depending on who your audience is, I would really encourage finding more specific resources for the audience that you're looking for. And this is really meant to be for those facilitating PSS and SEL related programming. Let's see, Sarah, I think you said there was one more question. Sorry, I'm lost in the chat function here. If you could reshare it. Where can we find all these materials? These materials can be found on INEE's website. And we'll be sharing this webinar as well as the presentation here on the INEE website. So please look out for that there.
Margie, the last question was, INEE has very good resource materials uploaded, but how is the feedback enhanced to establish its effectiveness in an emergency context?
Is that about effectiveness of this training module or about other INEE resources in general?
It's more in general. And so I can actually respond to that question. We really try to have our materials ensure that they are accessible and effective in an emergency context. And so we really want to hear feedback from the users and our members. So feel free to email INEE at any time with feedback or questions, and we really try to ensure that all of our resources are geared towards emergency context, and majority of our resources are. So if you have any further questions or want to continue ensuring that our resources are effective, feel free to send us an email.
Great, thanks, Sarah. Yeah, we really rely on you all out there who are using our resources to be able to tell us how effective they are. That's great. Okay, with that, I would like to say thank you so much to the presenters for all of the information provided. I would like to give a big thank you to all of the participants today. Thank you so much for joining the webinar, and we really hope you will find this module to be useful and effective for those people that you are serving. Please reach out if you have any questions, and look out for the webinar recording and PowerPoint presentations to share with your colleagues, as well as, of course, the module itself. Thank you, and have a wonderful rest of your day. Goodbye.
Bye.
Thanks. Bye.
Thanks. Bye.